Good afternoon. My name is Jasmine McCrea, and today's topic is phlebotomy, how to draw blood. Many of you may ask the question, what is phlebotomy? Phlebotomy is defined as the practice of drawing blood. Phlebotomy is an ancient profession dating back 3,500 years to the ancient time of Egyptians. Today's phlebotomists are now highly trained and using a variety of skills in the workplace. The purpose of a phlebotomist is to obtain blood samples. To safely and accurately obtain a blood sample from a patient, follow these easy steps and you will have no problems. Primarily, the first step in collecting a blood sample is to assemble your equipment and prep the patient. While taking a blood sample from a patient, I like to use a Winged Infusion Set. You will first remove it from its packaging and straighten out the coil tubing. After straightening out the coil tubing, you will then attach the Winged Infusion Set to a syringe. When using a syringe, loosen the plunger by pulling the barrel in and out. Now that the equipment is ready, you are to prep the patient. Take the patient's hand and place it in an accessible position and ask the patient to gently curl his or her fingers under their hand into a fist. Tie a tourniquet in a usual manner around the wrist. In addition to your assembly and patient prep, you are now ready to insert the needle and collect the sample. Once the tourniquet is tied around the wrist, you will start to see the veins arise in the hand. Choose the largest and straightest vein and clean the site. Grasp the needle between the thumb and the index finger, putting the wings together in the middle. Insert the needle into the vein by lining up the needle in the direction of the vein. Once the needle has entered the vein, you will see a flash of blood appear in the tube. Hold the needle in place with the thumb of the opposite hand. Slowly pull the plunger of the syringe back, matching the rate at which the blood is flowing into the syringe. When the tube is completely filled, release the tourniquet, remove the needle, and activate the needle safety device. After collecting your sample, you are to attend to the patient once more and correctly dispose of the Winged Infusion Set. Once you've taken the needle out of the patient's hand, with a gauze pad, apply pressure to the site. Now that you're done with the patient, you need to dispose of the needle properly. When disposing the set, the entire system should be gathered in one hand, leaving nothing dangle to get caught and cause an accidental needle stick. Drop the tubing, needle, and the attached adapter into the sharp container. You have now completed drawing your blood sample. In conclusion, collecting a blood sample is a very easy task if done correctly. Just following these simple steps will make the job a breeze for both you and the patient. Remember, when taking a blood sample from a patient, you pace yourself. Do not rush. You want to avoid the risk of puncturing to the other side and blowing the vein. Thank you for listening and listening. Do you have any questions?
Why did you choose this topic?
I chose this topic because it's something that I can relate to because I'm going to school to be a phlebotomist. So it's going to be what I'm going to do.
On a scale of 1 to 10, how hard is the practice of phlebotomy?
The practice of phlebotomy, if I had to rate on a scale of 1 to 10, it varies depending on the patient because some patients are easier to stick than other patients because their veins, some people have rolling veins, some you can't see some patients' veins, so it's like a blind process. Any other questions?
Do you think you will enjoy it?
Yes, I do. I actually did my first patient stick on Thursday, and it went pretty good. So I think I like doing it. Any other questions? Okay, again, I'd like to thank you for listening and attending, and goodbye.